We know so little about the brain. We know a lot about other organs, but the brain in particular, we only are scratching the surface of what's known. The way in which we think about how the brain works is going to evolve dramatically in the next several decades. In partnership with the leadership of Northeastern, we developed a model to increase the effective health and functioning of individuals across the lifespan. We're really focused in this space of brain health and mental health.
The long-term goal is that we're helping people lead healthier, more fulfilling lives. And so this might look different for different populations. So we want to think of unique interventions and strategies to better promote brain health, cognition, physical health across our patients and across our participants.
At the Institute, we study how different interventions, exercise-based interventions, can impact health across various populations. And we used various tools to really look at the brain and look at cognitive health. One of the tools that we are most excited about allows us to look at oxygenation and deoxygenation within certain areas of the brain, and how yoga or mindfulness meditation can actually impact specific regions of the brain for the practitioner.
The easy answer to how we should be living is that we should be much more physically active than we are today. We have problems with diabetes and metabolic diseases of that nature, but it also has an effect on the brain, and that's less well understood. And so the goal is to intervene early prior to problems emerging and to think about brain health much more broadly.
We're using music to design interventions for people with Alzheimer's disease and related disorders. The same brain waves that music is able to engage are usually disrupted even in healthy aging, but especially in Alzheimer's disease. So we're using music and we're adding lights to that. So we're looking at lights that flicker in time to music, and that light might restore brain rhythms that are disrupted in neurodegenerative disease.
I do like to come back to this idea that the brain and the body are connected, right? Increased fitness is related to decreased symptoms of anxiety and depression. And so these two features being related, I think, is a really unique part of the research that we're doing here.
What I'm really trying to do is identify how yoga and mindfulness can help improve a person's quality of life. And I feel like research is just now catching up and getting to know and discover what this historic practice can really do for the brain and the body.
For my work, undergraduates are involved in helping to run sessions and helping to run participants through different cognitive batteries, physical assessments, etc. So a student who's highly engaged, really passionate about the work, has a lot of opportunities to interact and engage with the research.
What happens when neuroscience and arts talk to each other? It opens up real possibilities for people within our lifetime to be able to buy something that changes our brain for the good. So I think I just want people to acknowledge the opportunities that music opens up for better brain health.
We built an institute that is a shared facility. People share desks, they share offices, and they share labs. We all look out for each other, we're contributing to each other's work. In building a model with that kind of culture, it has to be successful. If CBH's research succeeds, we have a population that is mentally more healthy.